Welcome to today's video on the theory on the level 4 diploma in advanced aesthetic treatment, and we're looking into unit UBT 467, which is on enhancing appearance using dermaplaning techniques. So the material we have split into 3 different sections, like you can see. Section 1, we have skin anatomy and physiology, so we'll discuss anything when it comes to A&P that is relevant to dermaplaning. Then on section 2, we're only going to talk about dermaplaning. What is it, how does it work, what equipment you're using. And then your section 3 is all of your treatment protocols. So how does the treatment go, what is the step-by-step, and everything that you need to know about carrying out your dermaplaning treatment. Now going into section 1, your skin anatomy and physiology, we're going to look closely into the structure of the epidermis, as that's the one that we're working on mostly when it comes to doing dermaplaning treatment. Then we have types of hair and also the hair growth cycles. That is one of the most relevant things when it comes to A&P and doing the dermaplaning treatment. Now going into the epidermis and desquamation. Now why are we looking into the epidermis mostly? Is because the dermaplaning is done on the top layer of the epidermis. So the epidermis is the top layer of your skin, and the reason why we're doing the dermaplaning on the epidermis is, as we've mentioned before, your top layer of the epidermis by itself is made out of dead skin cells, which are the dead keratinocytes. Now what happens is your keratinocytes are being produced at the bottom layer of the epidermis, the stratum basal. Then the keratinocyte maturation takes place, in which all of the living keratinocytes start moving and migrating towards the top layer of the epidermis. So by the time they reach the top of the epidermis, they will be dead and filled in with keratin, and they are a harder type of skin cells. There's another process that takes place within the skin that is called desquamation, that you might have heard of. What desquamation actually is the natural process of shedding those dead skin cells. So that takes place every 21-28 days. And what we actually do with the dermaplaning is exfoliate and get rid of the dead skin cells that could be a little bit of a build-up on them on the top of the skin. And there's another thing that we have already discussed that's called a cell turnover. This is basically the cycle of new keratinocytes being produced. They go all the way to the top and then being replaced by new keratinocytes. So it's a turnover of the cell production of the actual skin cells. Now to move on to types of hair. And why are we looking into this? Is because dermaplaning, actually the main purpose of the treatment is to remove peach fuzz or vellus hair. So looking into types of hair, we have terminal hair and then vellus hair. And you can see on the picture, on the left hand side, you have the terminal hair. So these hairs would appear quite thick, quite dark, and they run quite deeply into the dermis as well. And then next to it, you have the vellus hair. So the vellus hair is relatively thinner, relatively smaller in comparison to the terminal hair, not as dark, not as thick, very fine. And you can see the actual bulb of the vellus hair itself is a lot more superficially going into the dermis. Now what is the difference between the two? In here you can actually clearly see at a very close-up image of the terminal hair and the vellus hair. Terminal is quite thick, it's longer, it comes from the middle of the dermis, so quite deep in. Main purpose of terminal hair is just to offer protection to the skin, also regulates temperature as well. And then the vellus hair, you can see a lot more thinner, finer, not as long, and it's coming from the superficial dermis. And what does it do as well? It helps to regulate the temperature of the body and also sweating. So you can clearly see the difference between the two types of hair. And again, keep in mind with dermaplaning, we're only going to be targeting the vellus hair. Now when it comes to hair and the hair growth cycle, we have 3 main phases when it comes to the hair growth cycle. The first one we have is the anagen, followed by catagen, and then is the telogen. So each hair follicle has a cycle that consists of a really long period of growth, which could be anything from 2 to 6 years, for example, and then it's followed by a quite short period of a resting kind of stage. And during that resting period, the hair is still attached to the hair follicle, but it's actually not growing, as the growth has actually stopped and it's slowly going to become detached. And then after the resting phase is gone, the hair is actually ready to shed. And then once the hair has come out, it's being replaced by a new hair. And when it's being replaced by new hair, it's like an ongoing cycle of the hair growing for a few years, then slowly getting detached, falling out, and then being replaced by a new hair. So this would take place every 4 to 6 weeks roughly. So why do you need to know that? In case, if you're doing laser hair removal, for example, you would always tell your client to come back at a specific time. So come back anything from 4 to 6 weeks, when you can actually catch the hair growth cycle at where you need it to be. Or when you're doing dermaplaning, you need to tell your client, come back in 4 weeks time. That's when the hairs would have grown out again. Why? That's just how the hair growth cycle works, and then that's how long it actually takes. So that is all on skin anatomy, physiology, anything that is quite relevant when it comes to dermaplaning. So now going into the actual treatment. What is dermaplaning? What equipment are you using? What are the differences? Then what are the techniques that you actually need to use during the treatment? What other treatments can you combine that with? And possible side effects and complications that you might get with the treatment. Now, what is dermaplaning? And as you can see on the picture, it removes the vellus hair, and the vellus hair is the peach fuzz on the face, which is a very fine, very short kind of hair, and dermaplaning is ideal for removing that. And what it also does, by removing the vellus hair, it also removes the buildup of dead skin cells on top of the skin. So what happens with that is it reveals a radiant and glowy skin by exfoliating the top layer of your epidermis, and by also improving the skin texture as well. So very ideal for people that want radiant skin, glowy skin, and also makes it really nice when you remove the dead skin cells and the vellus hair and then apply makeup on, as the makeup really sits nicely on top of the skin. Now, equipment and what you actually need to use for dermaplaning. You have a dermaplaning blade, and you have actually different types of blades that you can use. So this is that's a scalpel. All of these are made out of stainless steel. Now you can see there's different sizes and there's different shapes. So the first one, the 10 blade, this is the one that you're going to be using. This one has a outwardly curved kind of blade with a very sharp tip. Why is that the one that we prefer? Because it has a curved blade and also a sharp tip. It gives you a lot of precision when you're working on, let's say, the chin, the nose, around the mouth. So you can really go into little small intricate areas with this blade. So it offers a lot of control, a lot of precision, which is why most of the time we choose to go with this specific blade. And you can see, for example, the second one, the 10R blade. It has a curved kind of front at the beginning. It has a rounded tip. It's relatively safer to use because it doesn't have a sharp tip. However, because it's very rounded at the front, it doesn't allow you to go freely around the nose or the chin, so you don't have that much control over it, over small areas. And why would you use this one, for example the 10R? Due to the fact that it's not curved and it has a very rounded tip, you can use it on clients with more sensitive kind of skin in order to really prevent any side effects. And then moving on to the third blade, this is the 14 blade, so relatively longer than the rest of the blades. Also has a rounded tip at the front. So due to the fact that it's longer and it's rounded, again, not a lot of precision with that one, but relatively more safe, and you can use that on people with the more sensitive kinds of skin. And now moving on to dermaplaning techniques. So how are you actually going to carry out the treatment? And as you can see, by moving the scalpel, by moving the blade, you're going to be removing the vellus hair, so the very fine hairs that you might see, as well as the buildup of dead skin cells on top of the epidermis. So how are we using the blade? And you can see on the picture, the blade is at about a 45-degree angle. Keep in mind, you always need to keep it at that angle. If your blade is at a lower angle, it's just going to be way too superficial and not actually being able to catch the hairs. And if it's at a 90 degree, it's the same problem. You're not going to be able to catch the hairs as you actually moving the blade accordingly as to where the hairs stand by themselves. So always a 45-degree angle in order to properly work. And then how you're going to use it will be with very quick and small movements. If you're dragging the blade, you will not really achieve as much. So by moving quite quickly and working on small areas at each time, you actually remove more dead skin cells. You remove every individual vellus hair as you're working very small sections, and you're being very precise and very quick with that as well. And by moving quite quickly and moving in very small directions, you always need to make sure that you're stretching the skin. So the problem with the blade is that it's incredibly sharp. So in case that you're not actually stretching the skin, the blade can go through and give you a little bit of a graze. So always make sure that you're working within the area and you're stretching the skin as to where the blade actually is. And then as you're doing the treatment, always make sure that you actually have the blade in contact with the skin. Don't raise it up. If it needs to have complete contact in order to get rid of the hair as well as the dead skin cells. So be quite careful to always keep it in touch with the skin. Now, complementary treatments and what you could combine dermaplaning with, and this is what most practitioners actually do as well, very popular in the industry. One of the most popular things that you can't combine dermaplaning with is a superficial chemical peel. Reason being, what dermaplaning does is it removes the dead skin cells as well as the hair. And why is it so great to combine with a chemical peel is because you've exfoliated the skin really nicely. Then when you put the chemical peel on top, now your chemical peel has a lot more penetration into the skin, as there are no dead skin cells on the surface of the epidermis. So then the chemical peel's results will be optimized, and the peel will have a lot more skin penetration rather than not having the dermaplaning done. So that's one of the most popular treatments that you do combine dermaplaning with. Just keep in mind, always use peels that don't give you downtime. Only use superficial peels. You cannot combine dermaplaning with a peel that is quite harsh, let's say a VI peel or a green peel, as that will have an incredibly compromising effect, as the peel would be way too strong. Dermaplaning we only do with the superficial peels. So let's say, for example, the revival peels that you can combine with dermaplaning. They have been designed to be used this way as well. You have 3 different types. You have the ageless, the clarify, and the illumine. Each individual one is formulated specifically for a skin concern, so do not mix any of the peels. Only use the peel for the specific concern that you're going to treat. You have the ageless TCA. That's for the aging skin, fine lines, wrinkles, premature aging, sun damage, due to the ingredients that you have. You have trichloroacetic acid, tartaric, and then lactobionic. So all of these can treat these concerns. And then the clarify, that's for the younger clientele with oily skin, congested, acne, blemish prone. The clarify peel has salicylic acid, niacinamide, zinc. So all of these target the oiliness. Get rid of the oil, control the oil, get rid of congestion. They're antibacterial, anti-inflammatory, so great for any breakouts. And also the niacinamide works on brightening up any blemishes. And then lastly, the illumine peel. This is for anything to do with pigment, so hyperpigmentation concerns, uneven skin tone, dull skin, even just being a darker skin tone. Illumine peel can control the further production of melanin. What's inside of the illumine peel? You have a blend of 40% of AHAs, mainly glycolic, tartaric, lactic acid, and then you have a 20% salicylic. So salicylic would get rid of any existing oil on the skin, and that would make way for the AHA acids to actually penetrate quite deep into the skin and really nicely exfoliate, hydrate, and brighten the skin. So that's all the peels that you can use with combination with the dermaplaning. Always make sure that you carry out your dermaplaning first, and then you follow up with your peel after that. Now, dermaplaning, side effects, complications, what could actually happen after the treatment? So first thing that you might see is grazes and any cuts. Why does that happen? It could happen for a few reasons. If you haven't stretched the skin properly, when the skin is not stretched, the skin would bend from the blade, and then the blade can actually cut through the skin. So one way to avoid this is by stretching the skin at all times. Work really small sections. If you're working at larger sections, you have a higher chance of actually grazing the client. And then also, if you are just starting out and you're a beginner to dermaplaning, you can use a balm. The balm provides you with more of a glide with the blade, and the balm also protects the skin from any potential grazes as well. Then the next one is potential flare-up and breakouts after dermaplaning. So this is something that could happen if your client already comes to you and has a spot or a recent breakout, which is still pussy or hasn't completely healed. And then even if you're not touching the spot, you do carry out dermaplaning. What will most likely happen is she will get a lot more spots around that area in a couple of days. Reason being, with dermaplaning, you're removing the top layer of your epidermis, so now any type of bacteria has a very easy way to go onto the deeper layers of the skin. And when that happens, what you will find is a lot of breakouts and a flare-up. So if your client comes to you for dermaplaning and they have a spot or a breakout that's quite recent, do avoid to do dermaplaning, because very likely this is what will happen. Even if you are working around the pustule, all it takes for your client is to touch the spot and then touch their face, and this is exactly the result. So quite careful with breakouts. And then moving on to the third one, bacterial infection. So this quite rare to actually see, but still a possibility. Bacterial infection, what can happen is just not being sterile. From the treatment, you are removing a top layer of the epidermis, so very careful with anything that is not sterile, any type of bacteria. So always make sure that the blade that you are using is completely disposable. So one blade is only for one client, and once you're finished with it, that gets thrown away in a sharp bin. Do not reuse your blades from client to client, as that will be a cross-contamination. Very careful with sterilizing, being hygienic and sterile, as yes, the bacterial infection is a possibility when you're carrying out dermaplaning. And then to move on onto the treatment protocol. So what's the step-by-step? How do you do the treatment exactly? Then what are your consultations when it comes to dermaplaning? What are you looking out for with your client, and what's your advice to them? Contraindications, aftercare, and then also insurance claim that you need to keep in mind when it comes to dermaplaning. So the first step of your treatment will always be to do a thorough cleanse, remove any makeup, any bacteria, any grime, just prep the skin for the next step that you're going to do, as the skin needs to be very clean for whenever you're carrying out the treatment. Then before you do the dermaplaning, especially if you're a beginner to dermaplaning, we do advise you to apply a balm. Not too much and not too little, but the balm would actually provide you more of a glide with the blade, so you can move freely, and then also keeps the skin protected from any potential cuts that you might do with the dermaplaning. So quite a good way to start practicing with dermaplaning and be somewhat safe from any cuts from the blade. Then you're carrying out the dermaplaning treatment as soon as you've put the balm on, and as you can see, a really good stretch of the skin, really small quick strokes, and working on very small areas around the face. And once your dermaplaning is done all around the face, then you need to start preparing the skin for putting on the chemical peel after that. So as you know, with chemical peels, the normal protocol for that is to use a prep mask. So here we're using the clarifying mask. Draw out any impurities and prepare the skin for the actual peel. After the mask, you're going to prep the skin, so balance out the pH, make sure that the skin is ready for the chemical peel. And after that, applying the chemical peel, and here you choose the correct peel for your client depending on their skin concerns. And once the peel is on, you can still use the dermal roller. Not too much pressure, very quick small strokes, work in small areas, and that just optimizes your results from the peel even more, and especially when that is combined with dermaplaning as well. And after the chemical peel, remove everything off the face, make sure that the peel is neutralized, and follow with the serum and the no needle mesotherapy. Why are we doing that? We're just pushing more active ingredients into the skin. The dermal roller opens up microchannels into the deeper layers of the skin, and then the cavitation pushes any active ingredients that you get from the serum even deeper. And again, as you can see, the whole treatment protocol is all about optimizing your results and delivering the best results that you can to your client. And after you finish with the ultrasound, you can put on a sheet mask. It could be quite hydrating, and you can also use your sheet mask in combination with the LED. Choose the LED light accordingly to the client's concern, and just carry that out for about 5 to 7 minutes. And then last step of your treatment protocol will always be to apply a sunblock in order to protect the skin when the client goes out in the sun, because you've done a peel, you've done dermaplaning, you've done a dermal roller, so quite a lot of things. So you always need to make sure that the client is protected when they go out after the treatment. So when it comes to consultation steps and dermaplaning, pre-treatment consultation, really important with any treatment really. But when it comes to dermaplaning, you need to have that chat with your client as to what the treatment is, how it will feel, what are they going to experience, what are the results going to be like. And when it comes to dermaplaning, a lot of clients come with you with the concern that as soon as they do the dermaplaning, the peach fuzz that you have removed will come back, and it will be thicker, it will be darker, and it will be longer. So what clients are afraid of is that the hair will come back very thick. And you do need to have that consultation with them in order to really educate them. When you are actually doing dermaplaning on terminal hair, which is the thick and long hair, yes, possibility that it will come back thicker or darker. Now, when you're doing dermaplaning on the vellus hair, it will come back the exact same way that it was in about 4 to 6 weeks time. So there isn't a risk of the vellus hair becoming thicker and darker, and you just need to make sure that your client is aware of that before the actual treatment. Also, just run them step by step as to what you're going to do, what they're going to experience, and also what the results going to be like, how many sessions they're going to need. So basically everything that your client needs to know about the actual treatment. And then assessing your client's suitability for the treatment. Now, there's a few things that come into place here. So first off, check the consultation form. So do they have medical history? Do they have any contraindications, anything that will probably restrict you or prevent you from doing the treatment? So you need to assess that. Also, the client's actual concern. So very careful with this. Whenever your client comes in, you always need to know what their concern is and what are they coming in for. What are they looking to treat? Not a lot of clients are actually aware what the treatment is for. So you do need to educate your client and make sure that they are expecting the results that you can actually deliver, and their expectations are actually realistic. So for example, if your client comes in for fine lines and wrinkles, looking to get dermaplaning to fix them, you do need to let them know that dermaplaning would not do that simply, and then recommend the correct treatment that would actually fix their problem. So you always need to discuss that with your client beforehand. Then carry out a patch test. So this is done if you are going to carry out a chemical peel together with dermaplaning. There's no patch test requirement for dermaplaning itself, but patch testing is required for chemical peel. So just take the chemical peel, put a little bit of peel behind the ear, wait for about 5-10 minutes, keep an eye on any reactions. If there is a reaction, you can do the dermaplaning, but you cannot do the chemical peel. And in case of a reaction, put down the client's record card and just say what the reaction was. In case of no reactions, just carry out the treatment as you normally would. Aftercare instructions after the treatment, really important, because your client needs to know what they're going to experience after the treatment, how to look after their skin, what to do, what not to do. As if you're not making them aware, they could have a compromising effect of the result, compromising effect of the skin. So really important that your client knows what they can do and cannot do after the actual treatment. And then scheduling future treatment. So you always need to tell your client Do they need another session? And if they do, how long before they get the other one? What can they do in between? What they could do in between from home? So very important, especially with dermaplaning. You always need to tell them, or you need to come back in about 4 weeks time, because that's when the hairs would have grown back. So your client needs to be aware of that as well. And then moving on to the contraindications when it comes to dermaplaning. So a big no-no would be a cold sore. Reason being, a cold sore is made out of bacteria. So when you do the dermaplaning, you're removing a top layer of the skin. So even if you're not touching the cold sore, what will happen is, if your client goes home, she touches the cold sore and then slightly touches her face, then the bacteria is spread onto the face, and what will happen is a massive flare-up and a bacterial infection that can be caused simply from the cold sore. So if they do have a cold sore, you need to wait for it to completely heal up, wait for about 2 weeks. Then when the cold sore is healed up, not a problem at all, you can carry out the dermaplaning. Pregnancy, a big no-no. Again, with pregnancy, quite tricky. You don't want to touch them. As soon as they've given birth, then you can do the dermaplaning, not an issue at all. And then open cuts or unidentified lesions, you can't really do that, especially if you're doing the chemical peel. If you're not doing the chemical peel, you can do dermaplaning around the lesions, but then you wouldn't be able to do much else for them. So as soon as the cut or the lesion is healed up, no problem, you can carry that out. And in case your client has a skin lesion like a skin tag or a mole, anything to do with lesions, you can carry out the treatment. Just do the dermaplaning around the actual mole or the skin tag. Be very careful not to actually prick that, as it can cause it to bleed, it can cut it off, so it could become quite nasty. So as long as you're working around that area, not an issue. Anyone on Accutane in the last 6 months, and Accutane is a medication for hormonal acne, you cannot touch them while they're on the medication. You need to wait for them to stop the medication, wait for another 6 months, and then you can carry out any treatment on them whatsoever. This is because Accutane has a very compromising effect on the skin, really thins out the skin, so they do need to be off the medication for quite a while before they can get any treatments done at all. And then laser surfacing, recent surgery, laser hair removal on the area, you need to wait for laser hair removal about 7 days. Same applies with threading, waxing, bleaching of the treatment area. 7 days, you need to give the skin time to actually heal up, then not a problem. But recent laser resurfacing or anything like microneedling, mesotherapy, Botox, fillers, you need to wait for good 2 weeks. You need to give time the skin to heal. You need to give time for the Botox to settle, fillers to settle. So especially careful with Botox and filler. As soon as they get the treatment done, you cannot touch them for 2 weeks. So after the 2 weeks, you can do anything that you would like. But in the first 2 weeks of settling for both Botox and filler, you cannot carry out any treatments on them. Then we have diabetes. With this, I would be quite careful as to the products I'm using. You always need to ask your client, when was the diagnosis made? What type of diabetes is it? And at the same time, if you're ever not sure whether you can carry out the treatment or not, just tell your client to get a quote from their general practitioners and to figure out if the treatment will actually be okay for them or not. So that's a very a common thing to do for practitioners. Just tell them to ask their GP. And then you have active breakouts. So any pustules, any recent breakouts, anything that you can see is still inflamed, anything that hasn't healed up, big no, you cannot do that with dermaplaning. As we mentioned before, there's a really high chance, really high risk of the actual bacteria spreading all across the face, and then the whole face can flare up and become inflamed. So just wait for the breakouts to heal up. Even if you are working around that pustule or the active breakout, still very high risk of the actual breakout spreading all across the face. So a definitely big no. And then you have a sunburn. If your client's skin is sunburned, just give it 2 weeks to completely heal up. If the skin is tanned, not a problem, but if it's actually burned, you need to give the skin time to actually heal. So that's on contraindication. And then moving on to the aftercare advice. So what should your client do? What should they not do? So retinol or any tretinoin, they cannot do that for 7 days, no matter the percentage of the retinol or tretinoin. Reason being, you've just removed the dead skin cells off the top of the skin. Retinol can have a compromising effect if it goes too deep into the skin. So they just need to stay off that for about 7 days until the skin produces new skin cells. Then no sunbathing, no sun tanning for 7 days, as well as fake tanning as well, as fake tanning will just defeat the purpose of getting rid of the dead skin cells and evening out the skin tone and texture. Sunbathing, sun tanning, you cannot do that because the top layer of your skin has been removed, and then the sun now has a easy way in to the deeper layers of the skin, so possible chance of hyperpigmentation with that one. And then when it comes to laser hair removal or waxing, threading, cannot do that for 7 days. Give your skin some time to heal up, and then any treatments are no problem at all. And the client needs to know to wear SPF 50 every day for 7 days. Why? Well, you've removed the top layer of the skin. You've probably done a chemical peel and a dermal roller. So they could be quite vulnerable to the sunlight. So they do need to protect themselves, especially for the next 7 days. And then no makeup for 24 hours. No exfoliating, scrubbing on the treated area. If they are exfoliating or scrubbing straight after you've done the treatment, they can compromise their skin as you've done quite a lot for them. So for 7 days, what they can actually do to help their skin recover and heal up and remain radiant and glowing, they can use a hydrating kind of cleanser, a very gentle cleanser, nothing harsh, no exfoliants, no scrubs. Just keep it hydrated and moisturized. Use moisturizers and serums that contain hyaluronic acid, vitamin C, niacinamide, anything that would help your skin heal up quickly and support it and keep it hydrated. So that's what they can actually do in the meantime. And then moving on to insurance claims for dermaplaning, and here you have a checklist of what you would actually need to have in case you do get an insurance claim from the dermaplaning treatment. So one of the most important things that you need to have is a before and after treatment signature. So your client needs to have given you a signature before the treatment, so that's informed consent that has to be signed up. Then after the treatment, they need to sign as well that they have been happy with the treatment. So in case of the insurance claim, this is what the insurance company will be asking you for, as well as before and after pictures. You need a picture before the treatment and after the treatment, how the client was. And then if you have done a chemical peel, they will be asking you for a patch test as well. So again, the patch test, if you have carried out one, which is a requirement anyway, that has to be recorded onto the client's record card. So in case of a reaction, they will be asking you if the patch test was done before the actual treatment. And then in case of any actual incidents during the treatment or after the treatment, that has to be recorded on an accident book. So in the accident book, just say the name of the client, what the actual incident was, where did it take place, when did it take place, what was the witness to that accident, and then everyone has to sign as to what was the incident and how that was dealt with. And then we have complaints. In case the client actually complains to you, you need to record that onto your complaints. You need to follow your complaints procedure, have it all written down. What was the complaint, when was it, who was it made by, and then how was it dealt with and who dealt with it, and all of that has to be signed up. So all of that you need to have in place in case of an insurance claim. So this is a step-by-step that you have to follow with each of your clients, really. And that is in case of any claims in the future. So that's everything that you need to know about the dermaplaning treatment, from skin anatomy, how to carry out the treatment, and I hope it helps.